A lot of people wonder, what am I going to experience with the ketamine therapy? And to be honest with you, it's different for each person, and it's different sometimes for people from session to session. It can range from a slight dreamlike state to profound loss of reality. And it's usually a relatively gentle experience, sometimes facing things that have happened previously in your life, but almost as if it's from a third-party perspective. And most people, even if they find it to be a difficult thing, find if they lean into the ketamine and go through the experience, they come out the other side radically transformed. It's almost as if the ketamine experience allows them to metabolize some of their past traumas so they don't haunt them or bother them in a ruminating way from then on. I had someone close to me develop a need for additional treatment for mental health issues, and they were basically declining despite almost every treatment out there, and we had to find something else. We discovered ketamine, we explored it, I researched it, and then was amazed to see how astounding it worked compared to months and months and months of things that didn't work. Several other family members and close friends ultimately tried ketamine based on our experience, and they had very similar results. So I started researching the medical side of doing it. I had 30 years of using ketamine almost daily in the emergency room, so I was comfortable with it as a medicine, but I hadn't seen it in psychiatric illnesses and was flabbergasted with how well it worked, and realized it wasn't available in our community, and that's what prompted my wife and I to bring Relevate Ketafusion to LaCrosse. Ketamine works very uniquely in the brain. It works in the centers of the brain where your self is defined. So if those areas of the brain are injured, you don't know who you are, you don't know how you should react. And in those centers of the brain, that's where ketamine is the most active, with a type of cell called a chandelier cell. And it's called that because every chandelier cell has about 300 tentacles that go out, and they actually strangle the outflow from different neurons or axons. And that allows the body to have a way to modulate the output of the neurons in the part of the brain that defines yourself. So imagine there's a blueprint of your actual self in that part of the brain, and your brain can modulate that to change it. For instance, if 100,000 years ago one of our relatives was in a cave and saw 3 of our clanmates get eaten by a saber-toothed tiger, our blueprint would be modulated. So we might be more alert, we might not sleep well, we may be hypersensitive. And back at a time when that was considered a species-saving adaptation, it's now considered a mental illness in the 21st century. What ketamine does is allows the chandelier cells to release their stranglehold on those axons, to let your subconscious see who you actually are, who's your actual blueprint. And then through this neuroplastic period, after those have been relaxed, the subconscious can start to work 24/7 at bringing you back to that blueprint, to who you actually are, so you don't have that feeling like, I don't feel comfortable in my own skin. And it's because you aren't, because you're not functioning toward your actual blueprint. The ketamine helps you do that. A typical ketamine induction is 6 treatments in a 2 to 3 week time period. Each treatment is about 40 minutes of ketamine infusion. There's a little time ahead, and there's some recovery time afterwards. So you can plan on an hour to an hour and a half of time in the clinic, more or less if you need it. After that, some people require an hour or 2 on the couch to rest, and we usually recommend that you take the rest of that day off until you're sure how you respond to it. You are not allowed to drive after ketamine for 12 hours, and so it's important that you do have arrangements made prior to your infusion for a ride. Our staff at Relevate Ketamine is better than almost any clinic I've seen across the country. We have myself, over 30 years of experience using ketamine almost on a daily basis. Our nurse practitioners were both emergency room nurses with me for over a decade each, and they have more than a decade of experience using ketamine. They also went on to become nurse practitioners and have specialized as board-certified psychiatric and mental health nurse practitioners. So between our experience with emergency situations, our experience with ketamine itself, and our experience with psychiatry, I don't think there's anyone that is better positioned to provide you a safe and effective ketamine therapy than Relevate Ketafusion. Our treatment rooms at Relevate are more spa-like than clinic-like. You're comfortable, you come in, you recline in a recliner. We have nice eye masks, you get a warm or a weighted blanket. We have headphones that play therapeutically proven music to work with the ketamine. But rest assured that you're being monitored by state-of-the-art ICU level equipment as necessary to ensure that your ketamine infusion is safe, and all of our staff have the ability to respond and provide emergency care if in the rare event that would become necessary. One thing that happens when you receive ketamine intravenously, you develop what's called a neuroplastic period. And during that neuroplastic period, the brain can be very much affected by positive and also negative influence. So what we typically recommend to prepare for your infusion, you get off of social media the night before. Don't watch the news. Don't do things that would put you in a negative state of mind. Try to stay positive. Don't drink alcohol the night before. Try not to the day of, and even the day after would be best for you from a recovery standpoint. We ask you to have no caffeine on the day of treatment, and you can't eat or drink anything for 2 hours prior to your infusion. When you come to Relevate Clinic, it is by appointment only. You will need a picture ID or a driver's license before your treatment. From there, you'll go into our spa-like treatment rooms where your vital signs will be taken, and then an IV will be established. You'll meet with a provider and discuss dosage and treatment duration of your ketamine infusion, and then you rest comfortably for the duration of that infusion, knowing that you're being monitored both by vital signs and by cameras the whole time you're in treatment. We also have the opportunity for you to recover in the room after your treatment or in our treatment recovery lounge. Patients often go on to needing some type of maintenance therapy. About 1/3 of people are fortunate enough that they never need another treatment in their life. They're done. Another third of people need treatments at times in their life when there's specific traumatic type events, a loss of a loved one, or a significant trauma, emotional trauma of some type or another. The other third of people, the final third, need some type of ongoing maintenance, and that can be as frequent as every 3 weeks. We will not do infusions more often than every 3 weeks. To 6 weeks to 3 months to 4 months, it varies so widely. The problem we have is we don't know up front which group each person's going to be into. And so we don't like to get behind on the ketamine, so we usually recommend that you have a maintenance session about a month after your infusion series. At that point in time, depending on how you're doing, we can either shorten or lengthen that time and strive to find out how long you can go. If you can get away forever, great, that's less ketamine, less money, and less time. And we again try to stretch out the maintenance periods for the same reasons. So we work to stretch out from there. And most people we find we can get out to 6 weeks or beyond, but there are exceptions on both sides. Why do we use IV ketamine instead of all the other methods you might see out on there on social media? And the main reason is effectiveness and safety. IV ketamine has been quoted as being 87% effective for treating mood disorders and chronic pain, while other methods are in the 20% effective range. IV ketamine also, believe it or not, is much more safe than the other methods that are out there. Its absorbability is much more predictable, and we can shut it off if anyone would possibly have an adverse reaction to it, and it's gone in minutes rather than lingering for the duration. Ketamine is absolutely amazing when it comes to treating suicidality. They found that after an average of 3.1 treatments, more than 80% of people were no longer suicidal, yet they still needed to complete the full induction series to make that stick. Everyone that gets an infusion at Relevate Ketamine needs to undergo a consultation with myself or one of our nurse practitioners. This is done virtually on confidential Zoom, and it can be done from the comfort of your own home. All you'll have to do is simply call the clinic or reach out to our website and register, and they usually take about 30 minutes to complete. Ketamine is considered an essential medicine by the World Health Organization. It's FDA approved as an anesthetic, but it is not FDA approved for treatment of mood or psychiatric disorders. Therefore, the cost of ketamine infusions is all self-pay. We do have options. We take credit cards. We do use HSA cards. We take FSA. We have care credit available.